I'm Kristen, and I am a pregnancy coach who works with pregnant mamas all over the world. I help you go from anxious and overwhelmed to really enjoying your pregnancy, preparing for a sacred natural birth, and giving your baby the beautiful beginning that you are dreaming of. Today, I want to talk to you about why you should stop following the standard pregnancy diet advice, because it's terrible, it's outdated, and it is not evidence-based. Most of the time, the pregnancy diet advice that we see today is completely focused on weight restriction. It's not focused on preventing complications, and it's not even focused on growing a healthy baby. And we would think, okay, what is the point of diet advice? Wouldn't it be on keeping moms low risk, and wouldn't it be on growing healthy babies? But that's not actually the case. It's all pretty much part of our cultural panic about obesity, and since moms tend to get a little bit rotund during pregnancy, well, that's where it is there. You may have heard people quip or even seen it on posters in your obstetrician's office. You're not eating for two. Well, there's truth to that statement, but that is a gross oversimplification that does not give the full picture. It's not any better than the advice of you're eating for two now, so just enjoy. Saying, well, you don't actually need to eat for two. That causes confusion for moms. And another often quoted piece of advice is you only need 300 extra calories a day. The problem with that is if pre-pregnancy you were eating like 1,200 calories a day and you add 300 extra calories on, you're not getting anywhere near what you need during your pregnancy. And if you were eating 2,000 calories a day, adding 300 on puts you right in the right range that you need to be in. But it's not personalized advice. It's not advice that looks at you, your situation, or where you are, or your baby. So it's not good advice. It's outdated, it's misleading, and it's oversimplified, and frankly, it's kind of patronizing. And there's no sense in treating women like you are a child during your pregnancy. What we have going on with the obesity epidemic, and even with pregnant women who are gaining too much weight, is a cultural problem. It's not a pregnancy problem. The same reason that pregnant women might gain too much weight is the same reason that Uncle Bob down the street is gaining too much weight, or, Elvira down the road is looking a little pudgy. It's because food choices today aren't focused on nutrient density and proper satiety for the human body. It's focused on what is easy and cheap to prepare and what sells. And that tends to be like, salty treats that combine fats and carbs, or sweet treats that combine fats and carbs. And that's not optimal for pregnancy or any other time in your life. So what you need to do is stop following advice that's oversimplified, patronizing, and frankly outdated and not based on evidence, and instead follow advice that is based on evidence. Now, I've done a couple of other videos that break down what you should eat during pregnancy, so I won't take a lot of time to break it down here, but your pregnancy diet should be founded on protein. You need 100 to 120 grams of protein a day, which is dramatically more than most women are getting, but it is what is appropriate for the pregnant human body. And it is what helps grow a healthy baby. You do need to get some healthy fats. Your baby's brain absolutely craves them, needs them, and must have them. A low-fat diet is no favor to your baby's body, your baby's brain, or even to your body and your brain. Many women struggle with postpartum depression. Well, your baby's brain is getting every healthy fat it can during pregnancy, and it's hoarding up to 10 times what it needs. So you need to make sure that you're getting healthy fats to give your baby what he or she needs, and also to make sure that there's that protective effect for your brain as well. You want to get in fruits and veggies because they do bring in micronutrients that you need, and you want to make sure that you're salting to taste. All of those things will help you have a foundational pregnancy diet that will grow a healthy baby and will keep you low risk during your pregnancy. The way that your body stays low risk is primarily through diet, because it is the expansion of your blood supply about 60% more than it was pre-pregnancy that facilitates all of the other changes that happen in your body, which is to every single system in your body. And of course, facilitates nourishing your uterus, nourishing the placenta, making sure there's enough amniotic fluid, and growing your baby. So you want to be able to eat enough food and the right kinds of food that help you and baby. Another beautiful bonus of protein is that that's usually what your body wants, because protein is the building block of everything, your baby, your body, everything. And when you eat more protein, you feel more satiated. It has a high satiety value. So you will find that while you may still crave sweets and things like that through pregnancy, you will feel more satiated. And even if you're at the end of pregnancy where baby's all up in here and you're feeling stuffed, you will know that if you prioritize that protein first, that you're getting to your body what it needs. And again, you will have fewer cravings and hunger cues for the stuff that isn't so good. And you'll grow a baby that is the right weight and gain the right amount of weight without extra fluff. And if you are a mom who tended to gain too little, you will know that you're gaining the amount of weight that you need for your baby. Now, I know all of this can seem complex and overwhelming. Like I said, I'm a pregnancy coach. I work with mamas all over the world, and one of the biggest things that we work on is getting diet right with foods that you want to eat and that you can fit into your busy life. I would love to work on that with you, and we also do so much more. I'm literally in your pocket. You can send me a voice text anytime, and we talk on Zoom regularly so that we can connect and you can get the support that you need no matter where you are in the world as you have your healthy, low-risk pregnancy, and also as you prepare for a sacred natural birth experience and giving your baby that beautiful beginning. Head over to birthbabylife.com/beautiful. I would love to talk with you about how I can support you this week.